I'm David Soma. I'm a non-invasive cardiologist here at Virginia Cardiovascular Specialist. I came down from Spotsylvania County to Richmond for undergrad and medical school at VCU, and then went up to Cleveland where I did my internal medicine training at Case Western Reserve Metro Health, where I stayed an additional year as chief resident, and then completed my training in Milwaukee at Medical College of Wisconsin for a fellowship. My strength is really that I'm a multimodality imager. I think I do things from echocardiography to nuclear cardiac imaging, cardiac CT, and then cardiac MRI, which I think really allows me to make sort of complex diagnoses and allows me to really customize care based off of using any of those modalities. And I think that leverages me towards really having an emphasis on primary prevention of cardiovascular disease, basically preventing heart disease before it happens. I love being able to help people every day. I mean, I think that sounds simple, but coming in when you walk out of the hospital, and some days are long, that's how it is, but I think going in and seeing someone that's sick and getting them through that, I think is huge. And I think breaking things down to a level they can understand and then working with them to find the best care path for them is really important, because as medicine progresses and gets more complex, and as patients get more complex, a lot of it not only is about what is the right medical decision, but what is the right medical decision for that patient and what lines up with their values. And I think that I find that super, super important. And that's how I approach sort of every patient interaction. A couple of things landed me here at VCS. First of all, during my last year of fellowship, my wife and I had our son. And I'm from Spotsylvania and she's from Richmond, so it made a lot of sense to get back home. And when I was looking at different jobs in the area, seeing people that sort of started here right out of fellowship and retired here at VCS showed that it's a great place to be. And I think the fact that they sort of are a private group where that's all they're worried about is taking care of their patients is awesome.